Hello, my name is Jensen Smith. I'm a Sports Medicine 3 student here at South Tahoe High School, and for my project number 5 on nutrition and performance enhancing drugs, I decided to research blood doping. What is blood doping? It's the artificial increasing of the amount of hemoglobin and red blood cells inside of a person's body in order to increase their VO2 max. VO2 max is a measure of how effective a body is at getting oxygen into the bloodstream and then utilizing it in the muscles. So increasing this is very important for athletic performance. Blood doping works because red blood cells and hemoglobin are able to carry oxygen from the lungs to the muscles, and increasing the amount of red blood cells and hemoglobin makes it easier for oxygen to get to the muscles and then the muscles to use them for cellular respiration. This makes the athlete have an easier time performing at a higher level. Hemoglobin is a complex protein made by the body for the express purpose of the transportation of oxygen. A normal person will have about 35% of their blood content being made out of hemoglobin, and additionally, having hemoglobin makes it 70% more efficient to transport oxygen throughout the body. During the transport of oxygen, there are many complex biochemistry processes occurring. The oxygen bonds to the iron, and then the iron is able to take it anywhere it wants in the body. This is why having low iron makes it much harder to do strenuous activity. Additionally, without hemoglobin, it would make it so much slower for us to do anything, and any significant movement would exert us. Erythropoietin or EPO, is a substance that is secreted by the kidneys in order to help with cellular respiration. It stimulates the bone marrow in order to produce more red blood cells. Usually, this is used to treat anemia or kidney disease, but it's dangerous when athletes begin to use it because the blood that comes out of this bone marrow can be linked to autoimmune diseases once the blood mutates. Additionally, the thickening of blood due to having more red blood cells and not enough plasma makes it more likely for a clotting injury to occur, like a heart attack or a stroke. Synthetic oxygen carriers are another way of blood doping. Perfluorocarbons and other synthetic carriers are typically used in emergency blood transfusions to make sure that oxygen is actually getting to the places of the body that it needs to be. But when athletes get it, they just use it to increase their VO2 max. Third, there's blood transfusions. There's two types of blood transfusions. There's autologous and homologous. Autologous is when the blood is taken from the athlete and put back into the athlete before the activity. That increases the amount of red blood cells that they had. And homologous is when it's taken from a different person with the same blood type. The advantage of homologous is that it can be done like right before an activity, rather than autologous, where it has to be taken earlier and have sufficient time for the athlete to recover before the event that they're taking place in. After the extraction, the samples are put in a centrifuge, and this separates the red blood cells from the plasma. This is because you don't need plasma in order to blood dope. There are further risks with blood doping. It's not the most dangerous way an athlete can enhance their performance, but it has been linked to an earlier onset diagnosis of heart disease, and the data has shown that every year a European cyclist dies from blood doping, and that's only in Europe and only with cyclists, so you can imagine how bad it gets with the rest of the world and all their sports. The main way of identifying if someone is doped is through a urine test. You can identify EPOs and synthetic oxygen carriers through urine tests. However, if a transfusion was performed, there's no current way to tell if it was autologous, but we can identify homologous transfusions through a blood test, and we have been able to do that since the 2004 Olympics. It's not illegal to blood dope. However, the problem is when you utilize this strategy to cheat in a sporting event, the association that hosts the event will most definitely punish you if you're caught. No legal action is typically taken against you. However, your accolades will be diminished, and you're likely to be used as a deterrent for athletes that might want to cheat in the future. Your punishment will be much more stern than something that's equally as bad, just because they don't want other athletes to be doing this.